Namaskar. You are watching Dr. KK Med Talks Friday with Dr. Anita Kant, non-stop 690th episode. Today is Doctor's Day, and I will be talking about a doctor who's special not only to me and all of us at this KK Med Talks, but also to many people across the world, across all stations of life, who has touched their lives, who has helped them without anything in return. From humble beginnings come great things. The remarkable and inspiring life and journey of Dr. K.K. Agarwal truly reminds one of those who started from a single room house and became a household name. Dr. Agarwal dedicated his whole life to what he called the dharma of a doctor. He had been closely involved with the evolution of modern healthcare in India and strongly advocated universal healthcare. Fondly remembered as a doctor with a stethoscope, he Dr. K.K. Agrawal always said it is the duty of every doctor to be available 24/7 for his patients and to save as many lives as possible. His greatest contributions to society was during the ongoing COVID-19 pandemic. He made more than 12,000 videos, held digital OPDs, and conducted over 5,000 daily webinars and online sessions with esteemed key opinion leaders across the globe to educate the public and healthcare workers about COVID-19 and COVID vaccine to remove the vaccine hesitancy. He reached over 100 million people during these turbulent times and became a household name. His timely advice helped save countless lives, not only in India but all over the world. This show that I'm hosting today is also his legacy that all of us are carrying forward. A teacher par excellence, a mentor and guide to so many. He has touched so many lives in so many ways. He was a very good friend and my classmate through my medical college. And on this Doctor's Day, I remember him with all my heart. He was the best clinician ever, the best human being ever, and the best friend to me and to everyone that he came in touch with. So now let's to move to the headlines of today. Today is National Doctors' Day, observed on 1st July every year to honor the legendary physician Dr. Bidhan Chandra Roy. Amid spikes in COVID-19 cases, DM makes face masks mandatory in Leh. Oxford Biomedica signs a new deal to make AstraZeneca COVID shot. Lancet study reports that two COVID jabs equally protect people in all body mass groups. Russia scraps remaining COVID restrictions. So now let's go to the topic of the day. I will be talking about backache in females with Dr. Rajiv Thukral. He's currently working with the Asian Institute of Medical Sciences, Faridabad. Welcome, Dr. Rajiv. He's an
Thank you.
Associate Director of Orthopedics and Head Joint Replacement Program. Dr. Rajiv Thukral has been associated with orthopedics since 1997. His area of specialization include arthroplasty of the hip, knee, and shoulder, arthroscopic surgery, complex trauma surgery. To date, he has performed more than 3,000 joint replacement surgeries. That's a large number. He is, in addition to his clinical duties, he is the academic coordinator and DNB student guide, regularly training and teaching surgeons from many parts of Delhi NCR the latest surgical techniques. He has written extensively on orthopedic issues, predominantly on orthoplasty and complex trauma, with over 25 scientific papers published in indexed national and international journals. He has co-authored books and chapters on knee replacement. He is an associate editor of the Journal of Clinical Orthopedics and Trauma and also the Indian Journal of Orthopedics. So I invite you over to the show. We will be talking today about women and backache. I don't know why, but somehow women tend to have more backache. Is it more common in females and why? If you could enlighten us.
So, ma'am, I think first and foremost, thank you so much for having me on this program. It's
You're
National
welcome.
Doctors. It's a very nice thing to be here and contributing in some way to Dr. Agarwal's vision. So the question that you asked me was, why is backache more common in women? I think the reason is purely because we are built differently. Men, of course, have stronger bones to start, stronger muscle mass to start, and therefore they are in a way naturally protected. As they age, they also have testosterone hormone, which is obviously a stronger hormone to build muscle and bone mass. So, not that they are inferior in any way, women, but basically it's their genetic and hormonal makeup that makes them a little bit more prone to having weaker bone mass as well as weaker protein mass in muscles. So that I would say is the real reason. And apart from that, I mean, to be honest, women are more hardworking. They're more, I'll say, active than the men of today. So they should have less problems, but then their lifestyles also involve dieting and stuff. So then, they lose out on that. And they don't understand the importance of maintaining good bone mass and maintaining good muscle mass when they are young, unfortunately. And I'm talking about general population, I'm not talking about specific people like you, ma'am.
Thank you. The even young women today, they complain of backache, teenagers, young women who started working. Why is it so? Can you enlighten us?
So I would say the most common reason that young women are weak is because A, they have been given less protein mass since birth from their parents, and B, because they are pretty conscious about what they eat. They are very figure conscious. They are very diet conscious. They have children at a pretty young age now. It's changing, thankfully, for the better. So they lose a lot of their own body strength, including the bone strength, muscle strength. So I'd say younger women today, A, being genetically predisposed, B, being environmentally predisposed, and C, being personally predisposed now because of their lifestyle.
Yes, that makes a lot of difference. So, coming to that, the next question that I'd like to ask you is that, nowadays we find that more and more women are working from home. So, when they are working from home, they sit for long hours on the computer, and they also get backache, and because of the posture, some cervical problems also. Any tips for them how they can avoid these problems?
So, ma'am, the reason I would say, in fact, not only women but men also, young men have a problem of backache when they're sitting at home is because they're overworking their lower back muscles without really strengthening them. So a sedentary lifestyle, whether it is at office or at home, not involving exercising of the back and not strengthening the muscles in the back, the core muscles really, the lower abdominal muscles and the back muscles will lead to their weakening. And if you're already having a weak musculature to start with, then of course you are more prone. Unfortunately, the pandemic has made it difficult for everyone to go and work at their workplaces and offices. They have to do work from home. But there are ways where you can actually prevent this from happening, the backache, and that is to basically make sure that you're not sitting in one place for too long. So get up and walk around a bit and come back and sit and do some stretching exercises. And also, since your back is overexposed, your neck is overexposed to long hours of strained work. So make sure you strengthen that part. So focus on building the muscles of your lower back, your abdomen, and your neck by exercises, by good nutrition, by good diet.
So, I mean, you suggest they should walk over to orthopedician, learn some exercises, and incorporate those in their lifestyle, doing it like on a daily basis.
So honestly, they don't need to really come to an orthopedic surgeon for that. They just need to be educated about it. They must be aware of this issue. They must be understanding that the reason they're getting their backache is most commonly because of this. I'm not saying this is the only cause. I'm not saying that for by a long shot. I'm saying that they should be aware, because if they're aware, then they can understand what needs to be done. And exercises are available on the net, a dime a dozen. They can just go onto YouTube, or they can go onto some of the websites which show the exercises. If they would like a guide who would tell them what is good and what is not good in the beginning, especially when they have pain, then yes. If the problem has been persisting for very long, or if there is some other issue happening along with the backache, for example, the pains going down the leg, or this, associated neurological symptoms like tinglings and numbness in the feet, or weakness, or generalized body aches or aches and pains in joints, the small joints of the hand or the feet, then of course they need to go to a specialist who will first diagnose their problem, make sure it's not something organic, will rule out some specific cause for the pain, and then bring them back to exercises if nothing specific comes out. If it's more functional, means because of sitting in one place and because of weak muscles, then they can do it themselves.
So another thing that I want to clear with you, because like you said, there are by the dime a dozen exercise videos and pictures on the net, and also on the YouTube. But somehow, copying it is always you need some akal for that. So
Right.
many a times they overdo it or they underdo it. So that's why I was asking you that shouldn't they first, for the first time, go to a proper person who can tell them how to do it, rather than just copying it blindly from the net.
Ma'am, you are absolutely right what you're asking, and sometimes a little knowledge is a dangerous thing, and Google can give you, like you said correctly, both sides of the coin and confuse you. So it's not a bad idea for the younger generation to get this technical knowledge, this specific knowledge from a specialist, whether it's a good physiotherapist or whether it's an orthopedic surgeon. But just to make it easier for people who are out there listening to this and watching this program, there are simple exercises in yoga which actually every person who has some mild backache, as long as there's nothing organic causing it, nothing in terms of a bony problem like infection or tumor or something like that causing it. The simple exercises are based on yoga. They are more based on stretching of the back and the lower abdominal muscles. And off the top of my mind, which I normally tell patients, there are three exercises. I tell them one is Pavan Muktasan, where you actually lie on your back, keep your knees bent with your feet flat on the bed, and then you raise and bring your knees to your chest. So that sort of pushing out the air from your abdomen and moving it either from the lower tract or from your upper abdominal tract, and hold that position for about 30, 35, 40 seconds, and repeat that 10 times, maybe 2 or 3 times a day. That's one exercise which is very simple, which does not increase any back. And once you graduated from that, then you can go to the second exercise, which is also called Setu Bandhasan, which is the bridging pose in yoga, where you lie again on your back with your knees bent and your feet flat on the bed, your hands by your side, and you use your waist and your muscle strength to prop your abdomen up, keeping your head and chest on the bed. So you're becoming a bridge in a way. And then again, you hold that for about 40, 50 seconds and repeat that, 10 times, maybe 2, 3 times a day. And once you're good at that, then you go to the third, which is a more sort of vigorous or stronger exercise, which is Bhujangasana, which is basically the cobra pose, which can be extended to the Naukasana, which is the boat pose, where you are lying on your stomach and you're using your either hands to prop yourself up, the head and chest region, or you're using the hand and your legs to prop your whole body up. So these three exercises is what I normally tell all my patients who come to me, as long as they don't have anything organic and they just have backache because of poor posture or because of not adequately exercising or not doing the right, exercise schedule, not knowing what to do. This is what I tell my patients. So simple tips.
Yes, this is very nice. You've told the names also, so they can follow it up, and I'm sure so many people will gain benefit from that. So, what precautions would you like to advise to housewives and working maids, women who work as maids? Because what to avoid, and how to do the household work in the right way so that they don't repeatedly land up with backache.
So that is like asking a person who doesn't know how to cook, like me, who doesn't do much work. But anyway, what I can tell you, ma'am, is of course keep your body a little light. Don't overeat and work because that will overstrain your back. And if possible, if you have backache already, then try not to bend forward. Instead, bend your knees and try to sit on the ground and do your work. Sitting is worse off than standing or walking around. Similarly, jerks and bumps are bad, so do everything gently and peacefully, gradually, and avoid lifting weights, is what I would tell. Maids usually, if you ask me, would not have problems because of function, because they anyways overwork and overuse their back and their twisting and turning and moving around and then carrying weights. Their children working at home. So they usually, I mean, at least as far as my limited experience goes, don't really come to the doctor or don't really have problems with back pain. But housewives, yes, because when they have maids to fall back on and they don't do their work themselves, they're not exercising regularly themselves. Some of them, of course, going to the gym, back, strengthening their back and the abdomen, so they do well. But otherwise, I think the bottom line really is to do some exercise every day. If you're not able to do exercises because of the pain, then wait for the pain to come down. Take a little, heat or hot water bottle if it's not having any swelling in the back, if it's not an injured back, and apply that ointment and rest it and give as much support to your back as possible, whether it's sitting or whether it's standing or whether it's traveling. Let the pain come down. You may need to take a muscle relaxant sometimes, but once the pain is down, then please, 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 for your own sake and for National Doctors' Day sake, exercise.
Right. So, talking about these young girls working out in the gym who land with backache, any specific, besides those three, or those are the ones that they should be keep on doing if they land up with a backache
So,
after
ma'am,
a
people,
gym workout?
yeah. So, if you're doing exercise routine in the gym and then you develop a backache, then usually there is either a muscle tear or there's a slip disc involved. So, at that point of time, I would highly recommend that you go to an orthopedic surgeon and get yourself checked. Make sure you're not going to worsen it, because sometimes if you do exercises when the pain's on, or when you've done some heavy weight training in the gym, or bending forward to do some stretching exercises, you may actually worsen it by doing the exercises. So go to the orthopedic surgeon. I'm sorry to say, but you'll need the orthopedic surgeon here. Go visit him. Make sure that the doctor is not sort of insisting on getting some sometimes you even might, for a young person, ask for an investigation quite early, like an MRI. Most times we as doctors try to avoid it because we know that it will go away, it will settle on its own. But sometimes these patients who are young, especially who've done some weight training in the gym or who've done some excessive exercise, whether it's aerobics or whether it's jumping or just lifting weights, bending forward, they do end up with slip disc problems and sciatica, and then they need proper care, supervision. They need to sort of take it easy, allow that pain to come down, let the disc which is irritated actually settle down, let the nerve roots become okay, and then yes, then you're back to the same exercise that I told you in the beginning. To start, always start off with abdominal, very very low grade stretching exercises for your back, which is while lying down. That is your Pavan Muktasan, and then graduate to the other two that I told you.
So, another question that I have is, does old age lead to more backache, and if so, why?
So old age is actually my area of expertise in a way, because ma'am knows that I'm predominantly dealing with patients who are in their late 50s, 60s, and 70s. Not that late 50s is old age. I apologize to everybody who thinks I have mentioned that. I didn't mean that. But when I talk about old age, I'm talking about people who are not active when they're getting older. I'm talking about anybody who's otherwise fit but not exercising. And as you get older, a woman, we all know, goes through menopause. And after the age of even 45, sometimes 50, you will have a drastic drop in your bone mineral density, causing your bones, especially the spine, to be susceptible to easy fractures. So when you do any exercise, or you have a little fall, or you lift some heavy weight at old age, you're not used to doing it, you're not building a bone mass by whether it's exercise or with good nutrition or with supplementation, then the problem is you can actually cause fractures in your spine. And these are called insufficiency or osteoporotic fractures. So we have to be really careful for these elderly women. We have to investigate right at the beginning with a simple X-ray. And if we are in doubt, then of course we go to CT or MRI scans. Usually, post-menopausal, not that it's a norm, but a patient who has a problem, who has a history, or who has a medical disorder, long-lasting, should ideally get a bone mineral density done during their annual checkup, which will sort of highlight the issue and give you an idea that this patient or this person needs to be worked up, or at least kept on the radar and watched out for any problems. So when they are old and they have backache, it's usually because of some fracture, and this usually again is because of osteoporosis. Another cause, of course, is if you have, and that's not a very good thing to know also or to think about, is a malignancy. If you have a malignancy, say a breast or a uterus, and that causes a secondary in your spine, then also you can get the same kind of backache. I mean, the same kind of problem in this elderly. You have backache in the elderly, and then of course you need to investigate in a different way. But in brief, in very precise and short terms, elderly with backache, please suspect a fracture. If not a fracture, look for malignancy. That's what we do.
Another thing that I wanted to know, that can osteoporosis be prevented if women are made aware of it early on?
So, ma'am, I think that's your department. You're the head of OBS guy. But yes, I think it's very imperative to understand that the peak bone mass for a young woman is around the age of 25, less than 30, in fact. So she can actually build up a peak bone mass with good nutrition, high protein diet, good water intake, calcium regularly, vitamin D regularly, good exercise and nutrition up to the age of 25, maximum 30. After that, all you have to do is maintain that, because the diets of today, the cola, the pizza, the fast food, they don't add to protein at all. They don't add to any bone sort of mass. And remember, as a woman, you're at a disadvantage already. So you're losing your peak bone mass after the age of 25 and 30. So if you're taught this early, when the woman comes in to, just married and going to have a child, especially with the younger gynecologists or the older experienced gynecologists already do it, I'm sure. They make the patient understand that not only is medication required, not only is supplementation required, but a good healthy lifestyle as well. And that, I think, the onus depends really, madam, on the gynecologists. There are very few young women who actually come to the orthopedic surgeon.
I agree. I agree with you totally on that. From adolescent, we have to tell them to eat healthy and take lots of calcium-rich food, because that is when the bones are really being strengthened and
Right.
gaining their maximum peak. But in the old age, coming back to the old age, can a fall lead to back problems? Because mostly we've heard it leads to fractures of the hip.
Right. So, ma'am, the three most commonly fractured bones in the elderly because of osteoporosis are the spine, the hip, and the wrist, the lower end of the radius. So, very commonly, if an elderly person comes to me who's otherwise active, has had a fall, a woman, definitely we get an X-ray, and the X-ray is done of the dorsolateral region. So the fractures occur at the dorsolateral junction. That means either the 12th dorsal, that means the thoracic vertebra, or the first lumbar vertebra. So we must be aware of this, that there is a high likelihood of you having a fracture at that age if you fall. So we need to obviously understand that the doctor is trying to rule out the fracture, because the other causes are, I told you, a little bit more serious, like malignancy.
Right. So, slightly deviating from the backache issue, how can we make a house fall-proof for the elderly?
Ma'am, that's a very good question, and most of the times we actually do the same thing. We again educate our elderly people that if they have to carpet the house, then it is better to have wall-to-wall carpeting, not to have edges where your foot can slip and trip and fall. Then other things are, if possible, have handles along the wall so you can actually hold on to that handle while walking around, especially in the dark or in the semi-lit areas, especially in the bathrooms where the floor can be wet. Make sure that the ground, the tiles are not sort of smooth or slippery. Make sure they're a little roughened so you don't have easy falls. And then, when in doubt, when you at the elderly age, you also have other medical problems like hypertension and diabetes. So you tend to have some drop in your BP when you suddenly get up. So please don't straight away walk as soon as you get up. Sit, wait for a half a minute, then stand, wait for half a minute, and then only get out of your position. Sometimes you also have spinal issues because of age, that is the spinal canal stenosis, and that can cause numbness and of your legs. So in that case also you
Mhm.
can fall. So if you have those medical issues, show the doctor, treat them. In your house, make it fall proof by avoiding edges, especially of rugs and carpets. If you have to use, and use wall to wall, use a railing on the side where you're going to be walking regularly. Make sure the areas are lit well. There are also some companies which sell fall prevention protection on the hip area, which won't allow your hip to actually break when you fall, because they'll cushion it. much like the airbag that we see in cars. But that's going a little extreme. We don't have that in India yet.
Extreme, yes.
Of course, yeah. And the other thing is, of course, make sure you're not walking on slippery surfaces or wearing slippery footwear. That's about it.
So now coming to the other end of life, does lifting heavy school bags and lifting them improperly in childhood make one prone to backache in later years?
So I wish that was an easy question to answer. I mean, you really can't tell a child or a teacher not to give school books or a bag to a child. But yes, if you're used to carrying the bag evenly distributed on your back, then you will be less prone to developing backache, or evenly distributed in the front of your chest. But if you're going to be carrying it on one side or using one arm to carry it all the time, then your body sort of naturally tilts, and that puts excessive strain on one part of the muscle, and then that will cause backache.
Yes, that's a very good thing. So we are this today with you on Doctor's Day. We are adding a new segment to our Med Talks, and that is most Googled question. So as we are
Right.
celebrating Doctor's Day this whole week, because one day is not enough to celebrate the lives of those who work tirelessly in giving their benevolent services and selflessly working for the well-being of mankind. We are introducing here at Med Talks a new segment, the top Googled questions, and today it will be on backache and bone health in females. So, Dr. Trukral, let me tell you what the people are Googling and giving them the answers. Why? First question, please. Shall I read out? Yes. Why is osteoporosis common only in older women?
All right. So this question actually is self-explanatory. Osteoporosis is most commonly seen in elder people because post-menopause they have a drop in their hormones and there's a sudden drop in their bone mass. And well, if you could change that, then women also would be happy. They wouldn't, but then men would be very unhappy because we wouldn't have children. So I'm sorry, but this is something that is going to be there even later on. What we can do is, of course, build up the peak bone mass.
Right. So, second question that people asked are, can we have it on the screen? What are the common bone disorders in women?
Hmm. All right, so that's a little longish sort of answer to give in this short, video and platform. But if I have to sum it up, I'll say for women, bone disorders usually bone and joint disorders. I'll say because it's not just bone. Bone disorders are usually osteoporosis and osteoarthritis and rheumatoid arthritis, and they are usually interlinked to one another. Osteomalacia in our country is also very common, and osteomalacia is not really osteoporosis; it's something short of it. But we'll talk about it some other day, maybe.
Yes. Coming to the next question, please. Basic early prevention for bone disorders in women. Could you tell us?
So I think you've heard that all throughout this little short 30-minute program, but it's basically about having a good diet, a good healthy lifestyle, making sure your peak bone mass is high, and don't overdo your exercise and don't overdo your cheap meals and your fried foods.
Right. Now, the next question. Do professional hazards lead to backache in women more than in men?
I think what the question really means is profession or a working profession causing more backache in women? The answer is if you have a peak bone mass which is lower, you are more prone. So yes, the answer is yes. Unfortunately,
So,
God has
next
given the
question.
God another
God
stick to
has
the
made
like,
us like that.
yeah,
Yes,
yeah.
yes. Could we have the last question, please? Lifestyle changes to ensure the prevention of backache. Dr. Chopral has been talking about it, but please repeat it for us, Doctor.
Ma'am, I think it's regular exercise. It's not maintaining one sitting posture for long and a good healthy diet.
Thank you. Thank you so much. You've really, taken us through a journey where we've learnt a lot about our own bones and our back and our joints. Definitely, I will get back to you for further topics in bones and joints. Could you show us his certificate, please?
Oh, I didn't need that, ma'am. I'm just going to accept the fact that you had me here. I'm really, really honored for that. Thank you.
Thank you, Dr. Chukral. But that's a ritual we have for everybody. And
Okay.
thank you very much. That will be all for today. Dr. KK Med Talks will be back tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Thank you, G. Thank you very much.